few messages. So you may have noticed, if you've been paying close attention, that the state health department, the Alabama Department of Public Health at alabamapublichealth.gov, has changed the way that they are reporting cases. Before today, they were updating a table at 10 a.m. and 4 p.m. every day to provide the number of cases by county of confirmed illnesses and also deaths in the state of Alabama. And they have since gone to a live dashboard that updates throughout the day, and so you will see the numbers changing continually throughout the day. So I checked just before coming in here. Statewide, they're reporting 489 positive cases of COVID-19 illness. In Mobile, we currently have 18 known cases of COVID-19. The state health department is reporting 4,082 total tests for the virus that causes COVID-19. In Mobile, I wrote the number down earlier today, but I can't recall it. I know it's less than 200. I think around 170, but that's what we're seeing in Mobile today. Unfortunately, we received word yesterday and today about the first patient who previously tested positive for COVID-19 that passed away. This is the first death in Alabama resident with a positive test. The patient had underlying health conditions and passed away at a facility outside of the state of Alabama, but was a resident of Jackson County. We want to express our deepest sympathy to the family and loved ones of the patient who died, as well as to the families of everyone who's been infected by the outbreak. Our state health officer made these comments today, and we concur with Dr. Harris and our colleagues at the Alabama Department of Public Health. You know, the health of our residents and community members and our families and our workers are our greatest priority, and we're continuing to work together to do the best that we can to try to keep illnesses down, keep severe complication to illness down, getting the hospitals the things that they need to care for the most ill patients and protect our healthcare workers and people of our great state.
Jackson County, Alabama.
Jackson County, Alabama. Did I say Mississippi?
Yeah, no, so people don't get.
Oh, okay. So the person who passed away was a resident of Jackson County, Alabama, but died in a hospital outside of the state. Thank you, Mark. So I want to we keep saying that patients who are people who are at greatest risk of complications from COVID-19 disease are the ones that we're really most concerned about. And I want to give you a little bit more detail based on data that's available to us now, what those at high risk look like. People age 65 and older, people who live in a nursing home or a long-term care facility. Other high risk situations include people with chronic lung disease or moderate to severe asthma, people who have serious heart conditions, people who are immunocompromised, including cancer treatment, people of any age with severe obesity, which means a body mass index greater than or equal to 40, or people who have certain underlying medical conditions, particularly if they're not well controlled, such as those with diabetes, renal failure, or liver disease. These folks might also be at high risk. And then people who are pregnant really should be monitored closely because they're at a known risk for severe viral illness. However, to date, COVID-19 has really not shown an increased risk around people who are pregnant. But everyone in those other categories, that's what we're talking about when we say those that are at highest risk for severe illness should be staying at home, covering their cough, isolating, using hand hygiene, staying away from others that might be sick, using those social distancing measures of 6 feet or greater to put distance between yourself and other people. So I'll mention a couple of other announcements, and then I'll turn it over to Kelly Warren with our Family Health Division. So we have gotten a lot of reports from concerned citizens that are out and about and trying to frequent our restaurants and our fast food and drive-through restaurant facilities, and we're really happy about that, and thank you for driving business their way. But during the COVID-19 emergency, the health department recommends wearing gloves when preparing any food for takeout service. So we're getting some reports from concerned citizens that food preparers are not wearing gloves when they arrive to get their takeout. So again, we recommend during the emergency, wear gloves at any time when you're preparing any food for takeout service. Later today at 4 o'clock, the governor and the state health officer and the superintendent of education will hold a joint press conference. This is at 4 o'clock today. You can get information on the state health department website. Has it been posted on our Facebook page?
It will be.
Okay, we'll post it on our Facebook page as soon as we're done here so that you can listen in or watch the webcast of that live newscast at 4 p.m. today. Another announcement from our state partners, the Alabama Board of Pharmacy has received reports from patients taking hydroxychloroquine as a maintenance medication for lupus and rheumatoid arthritis are not able to get their medication due to short supply. You may have seen in the press that there has been some unconfirmed information that hydroxychloroquine might be a suitable treatment for COVID-19, but these are still under clinical trials. So we're asking prescribers to exercise caution when prescribing these medications that may be in short supply during the pandemic. And then we get a lot of questions about the number of hospital beds, the number of ventilators, the number of ICU beds across the state. And I have a statement from our emergency preparedness coordinator that all the hospitals in the state of Alabama are uploading bed information 3 times daily into the Alabama Instant Management System. These numbers include all their bed types, including negative pressure rooms and ventilators. These figures are only shared with certain individuals on a need-to-know basis, and of course shared among our hospital constituents. So I just want to restate that we are not able to share specifics on the number of available beds, isolation rooms, or ventilators at our hospitals around the county and around the state. So at this point, I want to ask Kelly Warren with Family Health to come. She's going to give you some prevention messages and some changes to our family health schedule.
Good afternoon. Thank you, Dr. Murphy. Changes to our family health schedule. We wanted to let you all know these would be going into effect Monday, March 30th. We have just some minor changes to our clinic opening. Our newborn clinic will be operating on Mondays and Thursdays from 7:30 a.m. till 4:30 p.m. and we will only be seeing babies that are a year or younger at that site. So again, that's our newborn clinic located at 248 Cox Street. Mondays and Thursdays, 7:30 a.m. to 4:30 p.m. Our Women's Center will also operate on those same days, Mondays and Thursdays, from 7:30 a.m. to 4:30 p.m. to see pregnant women and do some just general family planning needs for refills. Our Keeler operations at our site downtown at 251 North Bayou Street, they will remain the same with 7:30 to 4:30 Monday through Friday for sick patients who are patients of Family Health. Of course, we will keep the information lines open during the week so that we can assist our patients with refill needs as well as medical triage needs and information. And that will be 7:30 to 4:30 Monday through Friday. At this time, several people are wanting to know what they can do to help, and there's been a lot of discussion and questions around homemade masks. And there is a national network of crafters called Masks for Humanity. Regarding the science around homemade masks, they are not to be a substitute for N95 masks, but they can extend the life of an existing mask and should be offered to patients as an alternative if there's nothing else available. Are they effective at protecting the workers? There is some research that shows that they are not as effective as proper medical grade protection. However, they could be used as a last resort, and some materials are better than others at filtering out viruses. Homemade masks can significantly reduce the number of microorganisms expelled by the person wearing it, and are 1/3 as effective in blocking transmission as all other surgical masks. So they do not have the capability that surgical masks have, but again, they are better than nothing. We'll have more information on how you can get in touch with Masks for Humanity posted after this broadcast. Thank you. I'll turn it back over to Dr. Murphy.
Thank you, Kelly. So another important change in our services beginning Monday is that the Alabama State WIC Department has been granted a waiver of physical presence by the USDA. So starting Monday, March 30, all WIC clinics will be allowed to complete appointments over the telephone. We're asking that anyone who has an appointment, please call their normal clinic number at your scheduled time, and our staff will talk you through your appointment. It'll be conducted over the phone. So to expedite the process, all proof required for WIC recertifications are allowed to be emailed to wicmchd@mchd.org. You can expect your phone appointment to take about 45 to 60 minutes, so make some time before you call. And if it's time for formula pickup, please call 251-694-3942 for phone benefit issuance. So just lastly, I'll remind you that we do have a public information line for COVID, 251-410-MCHD, and you can call that number between 8 and 4:30 Monday through Friday. There are additional resources available online, but the Alabama Department of Public Health also has a general information line that is open from 7 a.m. to 9 p.m. every day. We're only able to open Monday through Friday. The ADPH general information line is 800-270-7268. That's all we have for you today. Keep sending in your questions, and we'll see you again tomorrow at 2:30. Thanks, and stay safe, everybody.
Is in the state of Alabama, 18 in Mobile County, 4 in Baldwin, and 1 in Washington County. We do know those numbers are changing every hour here, so we'll keep you updated on that. Dr. Murphy also said that 4,082 people have been tested in the state of Alabama. Now, we do want you to stay tuned right here on Fox 10. We've got a lot of things coming up. At 4 p.m., President Trump will speak. Also at 4 p.m., Governor Kay Ivey, Dr. Mackey, and Dr. Harris, that's the Alabama State Superintendent, and the state health officer will have a joint press conference. We'll also have that at 4:30. Mayor Stimpson will also speak. So again, stay tuned right here on Fox 10. We will bring you the latest details coming up.